No, from KTN News. Away from that to something big happening this Friday. President William Ruto, who is, I think, on his way back to Kenya, will tomorrow assign to the 4 health bills that will support the revamp of the revamped Universal Health Coverage Plan. The National Assembly passed that bill on Tuesday morning. Health Cabinet Secretary Susan Nakumicha confirmed the president will assent to them before going to Kericho to launch the UHC plan on Friday at the Mashujaa Day celebrations. Our reporter, Husna Mohammed, has read through that bill and now reports.
Achieving universal health coverage is one of the targets that the nations of the world set when they adopted the 2030 Sustainable Development Goals in 2015. On 29 October 2023, the Cabinet considered and approved 4 bills for transmission to Parliament. The bills are the Social Health Insurance, Digital Health, Primary Health Care Bill, and the Facility Improvement Financing Bill. Section 104 of the Health Act 2017 mandates the Health Cabinet Secretary Susan Nakumicha to ensure the enactment of an e-health legislation within 3 years that provides the following: administration of health information banks, collection and use of personal information, management of disclosure of personal health information, health service delivery through e-learning and telemedicine, health tourism. Kenyans are set to benefit with an integrated digital health information system under the Digital Health Law. This is expected to provide patients' medical history by cutting costs that would have been otherwise incurred in taking new tests to establish each person's medical history. Kenya will now join the ranks of developed nations in making it compulsory for all visitors to have a travel health cover. Foreigners will be free to choose a private insurer that must be recognized in Kenya. The Health Cabinet Secretary Susan Nakumicha will, under the Social Health Insurance Act 2023, determine the minimum cover that the visitors will be required to hold. Once the Social Health Insurance Act 2023 comes into force, the Social Health Authority will replace the current National Health Insurance Fund. It will be segmented in 3 funds: Primary Health Care Fund, Social Health Care Fund, and Emergency and Chronic Illness Fund. Every Kenyan aged 18 years and above will be required to make monthly contributions to the new fund that will replace the NHIF. Those who fail to pay the monthly health premiums will be fined the equivalent of 2% of the defaulted amount for the period that it remains unpaid. They will also be locked out of government services. With many Kenyan families on the brink of bankruptcy amid spiking medical bills, these laws are being fronted as a relief, but the real test lies in implementation. Husna Mohammed, KTN News.
After the break, we head to the county of Kericho